Assalamu alaikum. I'm Professor Dr. Hayder Mubarak. This is a presentation to practical aspect about the topics of anatomy of male and female external genitalia. The male external genitalia is formed of two parts, fixed or non-movable part, which is this part, and free movable part, which is this part. The fixed non-movable part is called root of penis, while the free movable part is called the body of penis, and the root of penis continues with the body below the pubic symphysis. As you can see here, that this figure represents the perineum. This is the anal canal, and as you can see here, that the root, which is the fixed part, lies in the superficial perineal space. And I think that this figure was also reported in the practical session of the perineum. And you can see here, this is the Colles fascia, membranous superficial fascia, and this is the perineal membrane, which is inferior fascia of pelvic diaphragm, and this is the superior fascia of pelvic diaphragm. Thus, this is the superficial perineal space between the Colles fascia and perineal membrane, and this is the deep perineal space between superior and inferior fascia of urogenital diaphragm. And you can see that here in the superficial perineal space or pouch are the crura of penis on the right and left side, and the bulb of penis, which are parts of the root of penis. Therefore, the fixed part or the root of the penis is formed of right crura and left crura, and in the middle is a bulb of penis. And you can see that the crura is attached to the ischiopubic rami, which is formed of inferior pubic ramus and ischial ramus. The ischiopubic rami sometimes are called pubic arch. So the crura are erectile tissue that are attached to the ischiopubic rami on the right and left side, while the bulb, which is the third part of the root, a fixed part of penis, is attached to the perineal membrane. And this figure also shows that the bulb is attached to the perineal membrane, and the three are in the superficial perineal space. You can see also that these three parts of the root are covered by muscle. The muscle covering the bulb is called bulbospongiosus, while the muscles covering the crura is called or are called ischiocavernosus. So bulbospongiosus covering the bulb, ischiocavernosus covering the right and left crura. The free part of the penis, or the movable part of the penis, which is called body of penis, is formed by continuation of erectile tissue of the crura and erectile tissue of the bulb. The continuation, as I said, is in a region which is below the pubic arch, below the pubic symphysis. Therefore, you can see that the bulb continues into the free body, forming the so-called corpus spongiosus, and the crura continues on the side in form of corpora cavernosa. And I think this figure is well demonstrating that. Here you are separating the parts of the penis. These are the crura. Supposingly these are the root attached to the ischiopubic rami, and you can see that the crura continues forward in the free part of the penis, which is the body. Each crura forms corpus cavernosus, while the bulb, which is attached to the perineum, to the perineal membrane, continues forward in form of corpus spongiosum. You can see that the region of the bulb that is attached to the perineal membrane is perforated by the urethra, and I think this is also clear here that the urethra enters the bulb of penis, the root of penis. Actually, the urethra, this is the urinary bladder. After urinary bladder, there is a prostatic urethra inside the prostate, which is the first part of urethra. Then the urethra pass into the deep perineal space between superior and inferior fascia of urogenital diaphragm, and this part of urethra is called membranous urethra. So first prostatic urethra, then membranous urethra, and after that the membranous urethra perforate the inferior fascia of urogenital diaphragm, which is the perineal membrane, to enter the bulb of penis, which is the root fixed part of penis, as this figure shows. This is the membranous urethra entering the bulb of penis. You can see that the corpora cavernosa are two, and each of them is extension from the crus, and they are closely attached to each other. And both of these corpora cavernosa are related inferiorly to the corpus spongiosum, and I think this is a very clear figure for that. This is the free part of the penis, the body of penis. You can see the crura, the corpora cavernosa, and they are attached to each other, and below the groove between them is related to the corpus spongiosum. You can see that the corpus spongiosum contains also the urethra inside it, and you can see the corpora cavernosa and the corpus spongiosus are surrounded by fibrous tissue, which is called tunica albuginea. Therefore, the whole corpus spongiosum contains a urethra, which is the third part of urethra, that is called penile urethra. First you have prostatic urethra, the membranous urethra, and inside the bulb and the corpus spongiosum is a part, the third part of urethra, which is called penile urethra, that is opened on the apex here as external urethral orifice. You can see that the corpus spongiosum distally shows a conical dilatation that is called the glans penis, and the base of this conical dilatation projects outward from the corona glandis. This corona glandis covers a groove which is called the neck of penis, and I think such a configuration is also seen there. This is the glans penis, the distal dilatation of the corpus spongiosum. This base, the base of this conical glans is projecting outward from the corona of the glans, and this corona covers the neck of penis or neck of glans. You can see also that the external urethral orifice or opening lies in the apex of the glans penis. Regarding the coverings of the body or free part of the penis is covered with skin. The skin is thin and is loosely attached to the fascia of the penis. The fascia of the penis is superficial fascia, which is a thin fascia, loose fascia, the superficial fascia, the loose fascia, the superficial fascia does not contain any fat. Deep to the superficial fascia is the deep fascia of the penis, which is called Book's fascia sometimes. And deep to this Book fascia, you will find the tunica albuginea. So skin, superficial fascia, which is thin, non-fatty, then deep fascia of buccal, then the tunica albuginea, which is fibrous tissue surrounding the corpora cavernosa and the corpus spongiosum. You can see that deep to the deep fascia on the dorsal surface of the penis, you can see the dorsal vein of the penis, the dorsal artery of the penis, and even the dorsal nerve of the penis. This is on the dorsal surface of the penis when it is relaxed. Of course, the tissue, the erectile tissue of the corpora cavernosa and the corpus spongiosum are erectile tissue. When the spaces in this tissue will be filled with blood, the penis will be erected. The skin of the penis is forming a fold at the neck of penis, and this fold covers the glans penis. This fold is called the foreskin, and I think this demonstration shows that this is the skin, and here at the neck this is the glans. The expansion of the base of the conical glands is called corona glandis, and this is the neck. And at the neck you can see that the skin shows a fold that covers the glans penis. This fold is called prepuce or called foreskin, and I think that everybody knows that a surgical operation is done in our society to excise this foreskin or a prepuce in order to have a surgical circumcision. This is the operation of the circumcision. The surgeon usually cut around there and suture the skin, as you can see here. You can see the urethra inside the penis. As I said, this is urinary bladder. This is the prostate, and it contains a prostatic urethra. And this is the membranous urethra in the deep perineal space, and after which the urethra passes into the bulb of penis and then into the corpus spongiosum, or this part is called penile urethra. You can see that the urethra inside the bulb of penis shows the dilatation, which is called intrabulbar dilatation. And also the urethra at the glans penis showing a dilatation, which is called navicular fossa. So this is an intrabulbar fossa or dilatation, and this is a navicular fossa or dilatation. Both of them are in the penile urethra, but the intrabulbar is in the bulb of penis, and the other, which is navicular fossa, is in the glans penis. I think this is all about the penis, the external genitalia of male. We may add that you can see this is the pubic symphysis, a section into pubic symphysis, and here you can see how the root of penis have a junction with the body below the pubic symphysis. Also you can see that the body of the penis, the movable part of the penis, is suspended to the pubic symphysis by a ligament which is called suspensory ligament. Actually, this ligament is formed of fibrous tissue, and sometimes operations is done here to make some of the abnormal short penis longer. So this is the suspensory ligament of the penis. The other 2 points, maybe we have to say them, that the skin of the penis shows a fold on the under surface of the glans or under surface of the neck of the glans. This fold of skin is called the frenulum. And the other point, which is actually a logic point, that you can see that the interior end of the corpora cavernosus are conical, and they are covered by the glans penis. the enlargement of the corpus spongiosus that forms the glans penis cover a conical end of the corpora cavernosa. So all of these are descriptions to the male external genitalia, and I think other topics related to the genitalia of the male, for example, the testis, the epididymis, prostate gland, seminal vesicles. I will consider them, but with a title internal male genital organ, not external genital organ. So now I will have to describe the female external genitalia. The female external genitalia is described as the region of the skin that is perforated by the opening of the urethra and the opening of the vagina. This region of the skin is folded around these two openings. So you have an folded elevation, which is called the mons pubis, that contains hairy skin on the anterior aspect of the pubic symphysis and body of pubis. And also you have a lateral folds. The mons pubis is an anterior fold. Of course, the mons pubis contains much fat in the subcutaneous tissue. Also around the vagina and the urethra we have lateral thick folds, which are called labia majora, that are folds of fatty skin also. You can see that the labia majora have a lateral surface which is hairy and a medial surface that is not hairy, that is not containing hair, and it contains many sebaceous glands. You can see that the two labia majora, the right and left labia majora, unite anteriorly in a wide union called anterior commissure of labia majora, and both of these also labia unite posteriorly by a thin union or called posterior commissure. And the region between the posterior commissure of the labia majora and the anal opening, this region is called the gynecological perineum, or here it is labeled as perineal rough. It is called also gynecological perineum. The third fold is labia minora. It is also a fold of skin, but the skin here is devoid of fat. The two folds, the two labia minora, split anteriorly into two layers, as you can see. The anterior layers unite the two layers. These are the two layers of the labia minora, the anterior and posterior layer. The anterior layer on the right and left side unite here in front of the clitoris to form the prepuce of the clitoris, and they are unite here posterior to the clitoris to form the frenulum of the labia minora. Also, the posterior end of the labia minora unite here to form the frenulum of the labia minora. So you have a posterior frenulum between the two posterior end of the labia minora, and this is also a frenulum, which is resulting from union of the posterior fold of the anterior end. The space between the labia minora, the right and left space, is called the vestibule of vagina, which is this one. This vestibule of the vagina contains at the angles, the lateral angles between the labia minora and the vestibule, the opening of the great vestibular Bartholini gland. This is the opening of the great vestibular Bartholini gland in the vestibule of the vagina between the labia minora and the vestibule. And you can see that the vestibule shows the opening of the urethra, which is about 2 centimeters from the clitoris, and the opening of the vagina that is in the posterior part of the filling the posterior part of the vestibule. This opening of the vagina is closed partially by the hymen, and the figure here is pointed to be as hymenal caruncle because this is a hymen of married female. It is a perforated hymen, and these remnants of the closure of the hymen is called hymenal caruncles after perforation of the penis when she is married. And just behind to the vagina you may see a region which is called which is the most posterior part of the vestibule, that is called vestibular fossa. This region lie between the posterior commissure of labia minora and the opening of the vagina. In addition to this part, we have to talk something about the clitoris. The clitoris is formed of an erectile tissue. Actually, it begins in the superficial perineal space in form of two crura, right and left crura, just like the root of the penis, which has crura. So these are the crura of the clitoris. They are attached to the ischiopubic rami, and they are lying in the superficial perineal space. These two crura unite anteriorly to form the clitoris, as you can see. You don't have in the clitoris corpus spongiosus. You have only corpus cavernosus. The clitoris is formed by corpus cavernosus only. Each corpus cavernosus is a continuation, a forward continuation of the crura of the clitoris. And of course, similarly, the crura are covered by muscle, which is called ischiocavernosus. And you can see that the anterior end of the corpus cavernosus, which are continuation of the crura, we said that the crura continue in the clitoris as corpus cavernosus, and the clitoris is formed of corpus cavernosus. There is no corpus spongiosus in the clitoris. But the distal end of the corpus cavernosus of a clitoris is covered by a tubercle, which is called the glans glitoris. The surface of this glans glitoris is sensitive for sexual arousal. And you can see that you have a bulb of vestibule which simulates the bulb of penis, but here the bulb of vestibule is clefted. It is divided by the opening of the vagina and urethra. So the right and left bulb of vestibule in male are fused to form one bulb, but here you have two bulbs because they are separated by the opening of the vagina and urethra. And you can see also that the bulb is attached to the perineal membrane, which is the inferior layer of urogenital membrane. And also parts of the external genitalia of female includes the great vestibular glands or Bartolini glands that are lie in the posterior end of the bulb of vestibule. And I think we said that the opening of these glands is in the cleft between the vestibule and the labia minora. I think these are the main points about the external genitalia of female. I hope I'm helping. Thank you very much.